Okay, so today we have one new case. That new case is currently under investigation. It's a 68-year-old woman in the West Moreton area, and as we get more details during the day, we'll update Queenslanders during the day about that case. We also have two historic cases, so our active cases in Queensland remains at 11, and we have total confirmed cases 1,088. I really want to thank Queenslanders who have come out and been tested over the last 24 hours. We've done 13,715 tests, so well done. And of course, if anyone's got any symptoms, please come out and get tested. Well, as we know, there have been a large number of active cases in Victoria, and we are continuing to see cases in New South Wales. This is a very concerning situation. It's a very concerning situation that we are seeing the lockdown happening in Victoria and the huge impact that that is having on the economy. And our hearts go out to Victoria, and we know they'll get through this together, and we will continue to monitor what's happening down there. But the impacts on the economy are really large. We've seen our construction reduced down to 25%. We've seen impacts on retail. We've seen impacts on the way people live their lifestyle and the shutdown of cafes and restaurants. And of course, in New South Wales, we are continuing to see cases happen each day, and this is of great concern to Queensland. I can confirm that yesterday, members of the Queensland Disaster Management Group met extensively, and we have also met extensively again this morning. I can now confirm that our Chief Health Officer is declaring New South Wales and the ACT a hotspot. This will take immediate effect from Saturday, 1 a.m, and this is the right thing to do. I know it's going to be tough on Queenslanders, but your health comes first. Your health comes first. We need to protect not only our health, we need to protect the families, we need to protect our economy. We've seen what's happened in Victoria. We don't want to see that happening here. Businesses have said to me loudly and clearly that they do not want to go backwards. They want to stay where they are, and we need Queenslanders supporting Queenslanders. It's also very important that Queenslanders stay in Queensland. Now is not the time to travel to New South Wales. Now is not the time to travel to Victoria. And I will not risk the safety of Queenslanders, and I will not risk our economy. We've seen that Victoria is not getting better, and we're not going to wait for New South Wales to get worse. We need to act, and we have taken the decisive decision to act. I said I will not hesitate, and today is the day. Today is the day that I say to Queenslanders, we have listened to you, we are concerned about what is happening in the southern states, and today is the day that we say we are putting Queenslanders first. I want to thank Dr. Young for her extensive work that she has been doing in keeping our state healthy and keeping our state safe. But as we've seen, these continuous breaches that have happened by Queenslanders going down to Victoria, by Victorians coming up through the New South Wales border and into Queensland, is putting our Queensland at risk. And we have to do everything we possibly can to stop that. So this tough border measure against New South Wales, and we have to include ACT, because as the Deputy Commissioner will give an example of someone from New South Wales who went through Canberra into Queensland, is putting everything we have in Queensland at risk. We cannot risk a second wave. We have to act decisively, and today we have acted quickly. We have put Queenslanders first. I'll hand over to the Deputy Premier, then Dr. Young, and then our Deputy Commissioner, and we're happy to take questions. Thanks.
Thank you, Premier. That additional case in West Moreton means our number of active cases remains 11. 5 of those are in hospital. Here in Queensland, we went 63 days with no community transmission, more than 2 months with no community transmission. But that all changed 7 days ago. A lot can change in a week, and we've seen in other states how it can only take one case to see a widespread outbreak. In that week, we've had 9 cases here in Queensland, 2 travellers from Victoria, 3 cases of local transmission, 2 Queenslanders who travelled to Sydney, and 1 returning Queenslander via Sydney, as well as that 1 case today, and we don't yet know the source of their infection. Those cases have placed an enormous burden on our health system. We've done 85,000 tests in that week, 84,795 tests. We've contact traced thousands of Queenslanders. Many are now in quarantine. We've seen people go to great lengths to avoid our border lockdown. People be dishonest, people try to deceive our police, people lying on their border passes, and not just at the border, but right around the state, in Cairns, Townsville, Gympie, Nanango. In fact, police have now served more than a dozen notices to appear in court. Over that week also, Victoria has declared a state of emergency. Masks are now mandatory. There's a curfew in the city. New South Wales is on high alert, and we've seen cases there creeping north of the city. It is clear now that Australia is experiencing a second wave of COVID-19, and we cannot afford to have that second wave here in Queensland. There is also intelligence to suggest that some people are flying via the ACT in order to avoid our hotspots lockdown. Here in Queensland, our economy has just started getting back on its feet. Our plan to unite and recover and get people back into jobs is just starting to work. We've eased restrictions. Businesses are open again. People are back at work. We cannot afford to risk that progress. We cannot afford to risk the opportunity to continue to unite and recover. Throughout this entire pandemic, our Premier has stood strong. She has listened to the health advice, she has listened to Queenslanders, and that is precisely what we are doing today. These steps, there'll be some critics. It might be the LNP, it might be Clive Palmer. But we are doing the right thing to keep Queenslanders safe. Border restrictions have proven to be one of the most effective tools at stopping COVID-19 from coming into our state. And that's why today we are closing the border to New South Wales. All of New South Wales and the ACT will be declared a hotspot. This is a hard closure. The road border between Queensland and New South Wales will be closed to all but a very limited number of exceptions, freight, and those who live in border communities. This will come into effect at 1 a.m. Saturday. So if you're a Queenslander in New South Wales, please come home. If you're a Queenslander who has any travel plans to travel to New South Wales, please change those plans now. Anyone else travelling to Queensland and allowed to continue to travel to Queensland will have to travel by air or via the Northern Territory border. They will not be able to travel into Queensland via the Queensland-New South Wales border, and police will be enforcing that. We will also be strengthening the application process for border passes to ensure that people have to provide photographic identification. This is all about keeping Queenslanders safe and catching anyone who tries to lie to get into our state. With the nation's second biggest economy closed, with our biggest state economy on the brink, we need to keep the Queensland economy going for Queenslanders, but also in the national interest. And that's why I would urge the Prime Minister to support these steps, and I would also urge Clive Palmer to drop his dangerous and reckless case against state border closures. They are incredibly important. These steps, these measures will be reviewed at the end of the month. They will cause some inconvenience. But that inconvenience is nothing compared to what people are experiencing right now in Victoria, nothing compared to the inconvenience of having to go back to stage 1 restrictions. So I'd urge all Queenslanders to stay safe, to get tested if they are sick, to wash their hands, to keep their distance. Together we will get through this.
So one new case of COVID-19 was confirmed overnight in Queensland and 2 historical cases. The new case is a lady who lives in the Ipswich area. She's 68 years old, and we're just following through with her this morning to urgently find out how she's acquired the case. Now, it is very important that people continue to do what they've been doing. So 85,000 Queenslanders have got tested for COVID-19 over the last week, which is a brilliant result. And I recognise the impost on each and every single one of those people, because they need to then, after they've been tested, wait in their home in isolation till they get the result. And it is really, really important that they do that, and they have been doing that. So the 3 things that I implore every single Queenslander to do. The first one is, if they're unwell, to isolate themselves at home and get tested as soon as possible. The second is to maintain social distancing. We don't know where we might get another case in Queensland, and it's too late then to socially distance. So maintain social distancing and wash your hands. And the third is reconsider your need to travel to anywhere in New South Wales, ACT, Victoria or overseas. And if you do need to travel, it is an absolute urgent requirement that you need to travel, then when you come back you will, with very, very, very few exemptions, be going into hotel quarantine for 14 days. And as of 1 a.m. on Saturday morning, you won't be able to fly into Queensland unless you're bringing freight, so commercial freight, or you live in one of the border communities, or you live across the Northern Territory border and you're coming through that border. So as of 1 a.m. Saturday, Queenslanders returning home will need to fly home to Queensland, and if they have cars, organise alternative arrangements. Thank you.
Good morning. So in the last day we've seen 53 flights come into Queensland, 2,232 passengers have been processed, 126 placed into quarantine, none were refused entry. At our roads, 5,614 vehicles have been intercepted, 77 persons still refused entry into Queensland and 31 placed into quarantine. And on that issue of still refusing people coming into Queensland, can I highlight a couple of investigations that have progressed yesterday? You would have no doubt heard that 2 persons in their 60s at Nanango were found to have falsely declared on their border declaration passes. They have been issued with notices to appear for false declaration. Can I highlight to the community that these are very serious offences? They carry, as an on-the-spot fine, a $4,000 fine, and a much more significant penalty in a court of law, but more particularly also carry 18 months imprisonment as a potential penalty. So very serious offences indeed. Disappointingly for us, we're currently investigating a male person who we will allege, when they appear in court, has deliberately driven from Sydney out of a hotspot into the ACT to get a flight to come to Brisbane and then connected into Cairns. And that person has expressed they were frustrated with the restrictions, didn't like them and wanted to go to work. So a quite selfish approach to how this is doing. That person also will be facing charges. That highlights that this is the type of thing that's happening as people trying to get across our borders. And whilst our system is working quite well, we recognise that we cannot keep this up with the types of numbers that are coming, given the risks that we have to our community. So the announcements this morning will allow us, as we go forward, to really focus on everyone coming into this state. So unless people have either an exemption or a pass for freight, or as a cross-border resident, and there will be a very particular process they have to go through for their border declaration pass, which is currently being developed, verifying their identity, and also a specialist exemption, as the Chief Health Officer has alluded to. Unless they have them, they will be 100% stopped. So everyone will be 100% audited at both our road borders and our air borders as of Saturday, so there'll be no way to get through unless you have those exemptions. And indeed, all those other persons have the passes will still be checked. There'll be still random checks done of all of those as well. So we're committed to making sure that this state remains safe and that we keep COVID out of this. The messaging, as you heard, is very clear. The borders are a very important part of our defences in the state. They're not the complete defence. So, of course, we need to make sure our social distancing and hygiene and not going to work is all observed, because if anyone does get through and they're carrying the virus, we need to be able to stop it spreading. Thank you.
You're saying there, you said you can't keep this up. Is it too confusing, too cumbersome, the whole different local government?
No, the numbers of people that are coming through at the moment, what's concerning us is that the vast majority of people are doing the right thing. The vast majority. There are clearly a small percentage who are doing the wrong thing and deliberately deceiving the system to try and get through for their own purposes. What we've seen already, in one instance, is some of those were positive with COVID and infected with COVID. Whilst those numbers are small, the risk is too high.
Is your job easier now?
We anticipate that it'll be a much stronger compliance regime, so it'll allow us, with refusing entry to all of those that can't come out of the hotspots of Victoria, ACT and New South Wales, that we'll be able to do a higher percentage of auditing of those that are allowed through. So more people will be intercepted, more freight will be intercepted, more cross-border checks for those that are coming out of the cross-border areas. But in particular, the message to all those other people who don't qualify for those exemptions, don't come. You won't be allowed in.
Just to clarify, if I am a Queenslander coming back on Saturday afternoon at 3 o'clock, I can still drive across the border but go into quarantine?
You'll be going into 14 days self-paid quarantine. Self-paid quarantine. And can I just say also to the community, thank you. So in the last week, what we've seen is an increase in reports to police around concerns about people who are doing the wrong thing. Now that has led to a number of the investigations I've spoken to. So clearly the community has had enough of this, because we're starting to see those reports come in.
This seems extreme given the numbers in New South Wales are relatively small. They're nowhere near the Victorian numbers, and they seem to be fairly well contained to those hotspots or clusters. Is this just taking it too far?
Definitely not. We don't want to see a second wave in Queensland. We've seen how catastrophic it is to the Victorian economy. We are seeing New South Wales on edge. The Premier herself in New South Wales has said she is on high alert. They're encouraging people to wear masks in public places. My job is to protect Queenslanders' health and to protect our economy and our lifestyle. We've seen in Victoria there are 6,706 current active cases. In New South Wales, there are 255 current active cases, and New South Wales has reported 110 positive cases in the last 7 days. We have seen people deliberately flouting the law to get entry into Queensland. We have seen Queenslanders go into New South Wales at the Apollo restaurant and come back positive with COVID. We cannot put Queenslanders at risk. It is too important. You only have to look at the images that we're seeing down in Victoria in the aged care homes, where they now have more active cases in aged care than we have in total that we've had in Queensland over the last 6 months. This is the right decision for Queenslanders. It is a hard border closure with New South Wales, Victoria and the ACT.
Those businesses on the Gold Coast who have been screaming out.
It's going to be tough. It is going to be tough for some of our small businesses in some of those communities. So now today I'm asking Queenslanders to get out there and continue to support Queenslanders. But what would be more catastrophic is to take Queensland backwards, is to actually have to be shutting the Gold Coast because there's an outbreak of someone who has deliberately deceived the border pass, come into the Gold Coast, and then we have a second wave. That would be even more catastrophic. This is about protecting our economy and protecting Queenslanders' health.
Did you make an error opening them in the first place?
No.
Why?
No, because I always listen to the health advice, and that is exactly what I've done today.
We're taking Deb Frecklington at that point. You were pressured into it a bit, weren't you?
We continue? No, not at all. Not at all. I always take the health advice, and Queenslanders can be rest assured that myself and the Deputy Premier always listen to our Chief Health Officer. And we've also had our Management Committee meeting where we have met with the Police Commissioner and the Deputy Commissioner about these continual breaches of our borders. So the breaches will now stop.
How will it work? Politics playing is so close to the election.
This is about people's health, Patrick. There are people dying. This is a life and death situation here. Everyone is serious about this. I have travelled across Queensland and people are continuously raising with me about the strong actions we are taking to protect their families' health. Look what's happening in Victoria. People can't even see their loved ones who are dying in nursing homes. We are seeing an economy down there which is going to have a huge impact on the Australian economy. I need to maintain our strong economy here in Queensland. Our agriculture, our mining, our small business needs to function. We need to be supplying Victoria with food into the future. It is too important if we see the collapse of the New South Wales economy. We can't afford the collapse of the Queensland economy.
How will it work in those border support for tourism operators? I know Whit Sundays are calling more support. Gold Coast as well. Will you look at any sort of...
Yeah, well, I was actually up in, that's a good question. I was actually up in the Whit Sundays just recently, and I was at Airlie Beach, and the hotel told me that the majority of people that were staying in their hotel were from regional Queensland and from Brisbane. I deliberately asked the question, were there people from other states? Now, this is going to be tough for a few months, but everyone, we are in a world pandemic. You only have to listen to the World Health Organization. It is getting worse. It is not getting better. They are saying very clearly that every jurisdiction needs to protect its community, and that is exactly what I'm doing.
How will it work in the border communities? Will it be similar to what it was last time?
Yeah, so there's going to be a specific border community pass. There will be limited exemptions, but photographic ID will have to be shown. I tried very hard to keep those communities safe, but unfortunately the New South Wales Premier wasn't up to listening and up to making it smoother for those communities. So we know that there are emergency services personnel that work in those border communities and vice versa, and of course school students and business. We will work with them to make sure that they have those exemptions.
Still cross for healthcare and going to work?
Yes, of course. Yes.
Last night you released a statement, Premier, that said you've changed the rules around allowing diplomatic and...
Yes, through a health direction.
Changed because on Monday you didn't believe you had those powers.
So conversations happened with the federal government, and it was conveyed to us that we had the power in Queensland to put in place that exemption, and that's what the Chief Health Officer did.
But do you think schools should go ahead this year?
Oh, Patrick, look, it's a fair way off, but we can't have mass gatherings. We need to be very careful. I do want to get some advice on that. I'll be talking to Dr. Young. Everything's hard for everyone at the moment. Things are changing constantly, and schoolies may look at in some different form. It might be smaller gatherings. So I'll talk to the Mayor and I'll talk to the Chief Health Officer about that.
Are we looking at reimposing restrictions here in Queensland as to what people can do?
Not at this stage. We will update you if we need to make any further announcements.
Just some questions.
Is there any consideration on total border closure to every state and territory?
We are comfortable with the situations in Tasmania, in Western Australia, in South Australia and the Northern Territory at this moment. If there's any change, we will update Queenslanders on that.
Many came back from Melbourne. Have they tested negative or positive?
At this stage, yes, they have tested negative, and my understanding is they'll have another test. Yes.
Dr. Young?
Testing delays. What progress is being made? What's the turnaround like now, and what are you hoping for?
Yes, it has got longer, which is to be expected, given that 85,000 Queenslanders heard that call over the last week and came forward. And I'm very, very grateful to every single one of those. And I know that the amount of time they've had to wait for a result has increased. One would expect that. So it depends. It depends where in the state the test was done. It depends whether it was done publicly or privately, which fever clinic, etc., etc. So it varies, Patrick. So significant. It can go anywhere from a few hours up to several days.
And the lady Gibson, you don't know how she's contracted again?
No, I only found that one out this morning when we got the information. Because there are so many people getting tested, we can't get all of the details at the time that they're being tested, because that causes delays in those fever clinic queues. And given that one person has tested positive out of 13,000, I've given the request to all of the clinics. Could they just please test everyone, and we'll follow up later with someone who's
Presumably
positive.
she hasn't travelled or come back.
I don't know. I have no idea at this point, absolutely no idea. So I assume she's not in a hotel quarantine situation, because that would normally be documented on the form, but I can't even be certain about that. We'll get that information in the next few hours.
Dr. Young, acknowledging that you get a huge number of requests for exemptions, just to go back to the matter with DFAT, they've said that they never supported an exemption of that individual, and in terms of allowing interstate travel, that has always been the jurisdiction of the states. Can you just explain where the ball got dropped here with that particular individual?
The ball didn't get dropped. So that individual did everything they should have done, and the whole system did what it should do. But my concern is we're now well over 18.3 million cases across the world, so it's time to review whether that is still a sensible exemption to have in place. So I have spoken to my colleagues at AHPPC, because it was at AHPPC at the request of the Commonwealth that exemption was put in place early on in this pandemic. It's time now to review it, and I was informed that we could, as a state, unilaterally make a decision. So Queensland has done that. We are then going to further discuss whether other states and territories will do the same thing or not. That's now up to, the Commonwealth has said, that decision they now have left with each state and territory to make themselves. Initially, it was a joint decision that we all shared.
In that consular case, did Queensland Health grant the exemption first for the man to come back to Queensland, or was it New South Wales who granted the exemption for him to leave?
So New South Wales Health approached Queensland, and we said yes, it did meet that exemption. So yes, we would allow that person to travel as per the exemption. And the individual wore a mask, did everything correctly. The only concern I had is that when we agreed all these exemptions, we said when people went onto a domestic plane, that the planes would sit them with no one else around them. That unfortunately didn't occur because the plane was packed. So that's a concern, which is the other reason why I think that people must stay at their port of arrival.
Did it explicitly say that he was seeking that exemption to return to Queensland and not have to stay in hotel quarantine?
We did receive a letter from DFAT, and we received a letter from the gentleman himself.
That letter from DFAT clearly states that he is not a consular staff or a diplomat. Did anybody from Queensland Health check with DFAT on this man's bona fides?
That the letter's bona fide, I believe it is.
Was in fact consular or diplomatic?
He had a diplomatic passport. So yes, I was fairly comfortable that the information was accurate. I don't think there's been any suggestion that there's been any fraudulent behaviour here.
Was it referred to police? Why was any of this referred to police?
Just to make sure, as a double check, that the information was accurate, because I'm not an expert at determining fraud. So to me, it looked like a genuine letter. It had a stamp on it, it had a heading, but that's not my expertise. So just to make sure, given the enormous interest in this case, which I think is very, very appropriate, I think Queenslanders should be interested when exemptions are given. So that's the reason.
Does that letter explicitly say that man is seeking an exemption from hotel?
Yes. Oh, absolutely. Yeah. He was in quarantine in a hotel in Sydney, and he was asking, could he please be quarantined at home? That was the whole point of the exemption request, yes.
Two historic cases.
One's a lady who travelled to Canada back in February, March, came back perfectly well since then, but she was interested in knowing whether she'd maybe contracted the infection. So we do have the ability now to do serology testing. It was done in the private sector, confirms that she probably had it. Serology is not 100%, so that's why it's a probable case, not a confirmed case. Then the other person travelled to Tasmania back in March, and you might remember back in March Tasmania had that big outbreak in their northern part, so I assume it's related to that. I don't know that. Perfectly well since then, and she also was interested to know whether or not she'd had the infection. So they're of no concern today in Queensland, absolutely none.
To confirm, with the security contractor, does that mean then that the police investigation, if you like, is concluded?
Well, that's a question for police.
Simply yes. So we've verified the bona fides of what's been presented by this person and what they've said, and we have no concerns about that person at all.
Deputy Commissioner, just on the border pass, so how do people go about applying for that?
So it'll be the same system, so it'll be the same online system, so through Q Health or through the Queensland Government website, and that should be, we are planning to have that up and running by Friday night. Obviously the system's being built at the moment, so it'll be the same system, and then there'll be walkthrough.
You have to prove your address and photo ID.
Yeah, so
you have to submit that as part of the application.
Yes, so part of the application you have to identify where you're living. That will then tell them whether they're in the area that's exempt or not.
Yeah, and all those will be checked.
Deputy Commissioner, DFAT said that this is... DFAT did say that this individual had claimed on his paperwork that he was a consular official and that was contrary to what his employer's guidelines were. Is there a police response to...
No, we're very comfortable that this person, as the Chief Health Officer just said, has done the right thing. We're very comfortable with this, the information that's been provided. I think pretty clearly, as both the Premier and Jeanette Young have identified, there was a system issue here that's been addressed, and we think it's been dealt with appropriately. Thank you.